Good morning and welcome to a Tempe City Council special meeting. Due to the concerns over the COVID-19 exposure, the city has implemented measures to protect our community, including the closing of the city council chambers and limiting attendance via electronic means only. Members of the public may view the live meeting proceedings on channel 11 and or submit written comments via email to the council communicator at tempe.gov during this meeting and also obviously prior. I would like to welcome you all to this special meeting. Under the charter, I have the ability to rule by proclamation during an emergency, and I want to give the council, to get the council on board so that we are working from the same understanding and are also on the same page. We are taking action in declaring in the emergency in the event of further action is needed. We may need to enact necessary emergency response measures via proclamation during the duration of the coronavirus pandemic. Any action taken by the city will be done after much deliberation and done thoughtfully, and will be in line with the recommendations of the state and federal agencies for the safety of our citizens of Tempe and the public at large. Since we put out the information to the public about this meeting, we have received approximately 38 emails with a broad range of concerns and comments. These emails are still coming in, and we will add any email received before the adjournment of this meeting to the meeting minutes so that the public comments will be online and available to the public. I understand the public's concerns, but as we move forward, I want to make it abundantly clear that we have to work with the health of the public in mind. That does not mean that anyone should panic. We are not quarantining anyone at this time. We are asking people to act in accordance with the guideline put out by the Arizona Department of Health Services and the CDC. Those recommendations as of today are as follows. If someone in your family has tested positive for the COVID-19, please keep your entire household at home and contact your medical provider. Strongly recommend that dining establishments in the areas of known spread, that includes Maricopa County, discourage dining in traffic and instead provide curbside pickup or drive-through service. Do not visit nursing homes, retirement homes for long-term care facilities unless to provide critical assistance. Recommend canceling or postponing gatherings of 10 or more people, and recommend telework or other alternatives when available. Obviously, we need to increase our hand hygiene with soap and water for at least 20 seconds. Stay home when you are sick, and we ask that you take care of yourself so that we stem the spread of the COVID-19. We need to flatten the transmission as quickly as possible. I've heard from some folks that the COVID-19 has caused fewer deaths than the flu. While this may currently be true, COVID-19 is deadlier than the flu. The incubation time is longer and the hospitalization rate is higher. The fatality rate for the flu is 1% or less. While we have seen that the fatality rate for the COVID-19 is 1 to 3.4%. It is especially impactful for individuals who are older and who have medical conditions. We also know that COVID-19 virus can stay infectious for up to 24 hours on soft surfaces and several days on plastic and stainless steel. Please make sure that you are taking the time to disinfect your home and the items that you touch often. Also make sure to wash your hands thoroughly or use the alcohol-based at least 60% in a sanitizer form. Do not touch your hands to your face, your nose, your eyes with unwashed hands. Wipe off hard surfaces at work and at home with bleach, wipes, alcohol wipes, and other commercially available household cleaning solutions suitable for killing germs. Please cover coughs and sneezes with tissues or also use your elbow. Get the flu shot if you missed one earlier in the season. Many locations and doctors are still offering the flu vaccine. We're also talking to external partners like the Maricopa County Department of Public Health, Tempe Schools, Valley Metro, Tempe St. Luke's Hospital, ASU, and more. Avoid shaking hands and physical contact, but distance yourself between you and other people around you. As you can see, we have Councilmember Adams and myself here. And at this time, I'd like for the council members to at least state that you hear it, and I can finish the rest of my comments. Is Councilman Arredondo Savage on the line?
Yes, Mayor, I'm here.
Councilmember Arlene Chin?
Yes, Mayor, I'm here.
Vice Mayor Lauren Kuby?
Present.
Councilmember Randy Keating?
Yep, I'm here.
Councilmember Joel Navarro.
Yes, I'm here.
Thank you, Councilmember Navarro. Obviously, we need to avoid shaking hands and physical contact and put distance between yourself and other people around you, especially if you're at greater risk of getting very sick. As I said, the CDC has issued guidance that older adults and people who have severe underlying chronic medical conditions seem to be at high risk for developing more serious complications from the COVID-19 illness. For more information on the COVID-19, please visit the City of Tempe's website at www.tempe.gov//coronavirus. For my council colleagues, I would like you to have the opportunity to speak. I would ask that you keep it brief. I'm going to institute the 5-minute rule that is in our council procedures. I'm not asking this because I want to stifle your comments, but we have some of our staff here in this room and watching this meeting on TV, and we need to make sure that everyone is working on informing the public about our action today and helping to stem the spread of the disease. Now, as item number 1 is on the agenda, is to hold a public hearing and adopt the emergency ordinance declaring an emergency effective life, health, safety, and property of the public peace of the City of Tempe relating to the virus COVID-19 outbreak of 2019-20. The ordinance shall be passed on the affirmative vote of at least 6 members upon the separate roll call, and it will be effective immediately. I now look for my council colleagues, if you'd like to say something, or is there a motion on item number 1?
Mr. Mayor?
Yes,
I'd like to-
Councilmember Adams.
Yes, I'm very concerned about the businesses and also the employees that work both at the city and outside the city for their job loss. And there's a lot of the service industry that's been hit hard. And I would just like to recommend that we put together a task force made up of the Chamber of Commerce, Ken Jones, our CFO at the city, and any other members of the community that might want to participate to just kind of brainstorm what we can do and what the city can do. I know we'll have federal funds coming, but also what the city can do to make this as easy as possible for both our businesses and our residents that possibly could be losing their jobs.
Thank you, Councilmember Adams. I will take that under advisement, but just let you know, we do have a task force of staff working with constant communication with the Chamber of Commerce, with the Downtown Tempe Authority, and also the governor issued the Small Business Administration for Arizona opportunities. It was also on public through Local First to assist some of those businesses in our community. So we are definitely taking that under advisement, and we are definitely communicating with the business community, and we are all in this together. So we are definitely move forward on that action.
Well, just to add to that, that the city of Tempe look at what we can do financially to help the businesses and the residents of Tempe.
Absolutely, it's under advisement.
Thank you.
Anyone else on the council? If not, is there a motion?
Yes, I'd like to make a comment.
Okay, Vice Mayor.
Lauren Kuby. So the bulk of council communicators we've gotten has been in opposition to business closures, and the opposition has been financial in nature. And we're all sensitive to the devastating economic impacts of our choices, from this declaration on businesses and on individuals. But health and safety of people has to be our primary concern. So I'm thinking of a local bartender who wrote to us this morning about activities in her South Tempe bar last night on St. Patrick's Day. She wrote, "I alone, not to mention my 10 other coworkers, sold $1,000 in sales at my bar within 1 hour. The bar was full of people sneezing and coughing and being closer than 6 feet apart. For our safety, you need to close down bars and restaurants. People are not listening when it comes to social distancing, and I'm terrified to go to work." Without a mandate from government, businesses are not likely to shut down on their own, and it puts employees in a position of choosing between their jobs and their own health and the public health. A resident who works at a local bank yesterday wrote to us and said they will not shut down unless told to by the government. She went on to speak about her own chronic immunocompromised health condition, said, "Because my work will not close, people are going to work sick. I'm concerned that by forcing us to work and not having a citywide and state and federal level closures, that I'll get sick with whatever my coworkers have. What that means is that if Tempe doesn't take steps like Italy has, I'll end up in a hospital. The typical cold or flu that would barely affect you, that will hospitalize me and could potentially kill me. I am not alone in this." And so this is the direness of this measure, and I understand there are people concerned about this unprecedented step. but I would just say that our decisions have to be based on the public health. Our staff has been amazing in bringing together coalitions of people and scientists. And I am also submitting for the public record today a report that came out from the World Health Organization that is pretty dire about the impacts on health, even if we do get a 75% success rate in distancing. Like, this is obviously a dire issue, so I fully support the resolution. And we need to navigate life right now, assuming that anyone we come into contact with may be infected, and that we might be as well, which is why, since I had to fly last night from my mother's death, I was in New York. I'm not going to be at the meeting because I've been on a plane in the past day. But we all, as leaders, have to navigate life in that way. And the information we have, the testing we have is dangerously limited, and I know that we're going to see improvements as we start to see federal and state and regional assistance, but we need to, as a city, take the measures that we see other cities are taking to close down restaurants and businesses and allow for essential businesses and workers to work and protect those essential businesses and workers. Thank you.
Thank you, Vice Mayor. Is there anyone else on the?
Mayor.
Yes,
Mayor.
Councilmember Arredondo Savage.
Yeah, Mayor, thank you so much, Mayor. First and foremost, I think we all know that these are really unprecedented, trying times, and I wanted to take a quick second to, just thank this community for all the kindness that I've really been able to see, but also our city staff who continue to work extremely hard and provide outstanding service. I know Councilmember Adams mentioned the safety and the concerns of our frontline employees, which I certainly agree with. I think that's something that we need to make sure that they are definitely taken care of. But I just want to say thank you to our dedicated employees who are working really, really hard in some unforeseen circumstances that seem to change and evolve every single day. So thank you guys so very much for what you do. I wanted to say first and foremost that health and safety is the utmost priority for me, and I think this will give us the ability to do what is needed and required to make sure that our community stays safe. But at the same time, I want to agree with Councilmember Adams that we really need to make sure that we're looking after our businesses within this community and their employees and all the employees that actually do business in Tempe. So I love to hear, Mayor, that you mentioned the task force. I'd like to know who's involved in that task force, what stakeholders will be on that. I think that's going to be really critical. I'd like to give them some direction to leave no stone unturned to really talk about best practices across the nation, innovative ideas within the city of Tempe, whether it's us leading by example or helping financially if that's possible. I'm certainly open to those certain ideas, but I really want to make sure we have the right people around the table that can help us make some really good decisions, and that we continue to do whatever is possible to ensure, if there is state and federal funding available, that we are able to help bridge that gap. I think that's one of the things that we need to continue to advocate for, and really just be aware of the impact that this is having on our community and the economy, which is going to affect everybody within the city of Tempe. So I do support moving forward with this item, and again, I just want to say thank you to everybody and their really hard work. And I couldn't be prouder of this Tempe team and what we continue to do for our community. Thank you.
Thank you, Councilmember Arredondo Savage.
Mr. Mayor,
Yes, Councilmember Keating.
I move we approve the item.
There's a motion by Councilmember Keating,
I'll second.
seconded by Councilmember Arredondo Savage. Anyone else like to have a comment? If not, we need to do a roll call vote, voice vote. All those in favor, Councilmember or Vice Mayor Kuby,
Aye.
Councilmember Arredondo Savage,
Aye.
Councilmember Arlene Chen,
Aye.
Councilmember Adams,
Aye.
Councilmember Randy Keating,
Aye.
and Councilmember Joel Navarro,
Aye.
and then myself, aye. That motion passes 7-0. With that, I do want to give my condolences to Vice Mayor Kuby with your mother, the passing recently of your mother. And with that, our meeting is adjourned.